Good morning. My name is Dylan O'Connell, and today we'll be talking about Allen's cognitive levels frame of reference. And this frame of reference was first developed by Claudia Allen in the 1960s. However, it wasn't widely used or began to gain popularity until the 1980s. In this frame of reference, Claudia Allen talks about 6 levels at which clients function cognitively. And this is aimed to help the occupational therapist, determine the cognitive functioning and the activities you can do with that client. The first level is in the Claudia's cognitive levels frame of reference is automatic actions. And the picture I have for this is I have a stick figure with arrows pointing towards their center or their centermost part of their body. And this really describes that the patient at this level can only react to the body's innermost automatic actions, such as if you put a balloon in front of them, they might open their eyes to sensory integration, to visual integration. But that is about it. This level is the closest to the comatose as you can get. The second level is posture actions. And my picture is 2 stick figures holding hands. Now, one is the therapist and one is the client. And during this level of cognitive functioning, you're often going to have to grab the client's hands and initiate an action. So you're going to have to use proprioceptor training and help with that, assistance. So a lot of times they'll be able to do activity, but you're going to have to initiate that, like grabbing their hand to bring a spoon of soup to their mouth if you're teaching them and helping them eat. The third level is manual actions. And even though during this level they can't really actively learn yet, per se, they put emphasis on their tactile, their touch sensory. And so to really help them do activities, you're going to have to do things that they can touch and they can sense with their hands in this level. The next level is goal-directed actions. And in this level, I have a pair of glasses here. I could have just used mine. In this level, they are really using their sense of sight and their visual sensory to really understand the environment. So during this level, it is important to know that the patient can only understand what they can see. So if they can't see something that's too far away, they're not going to be able to understand or take it in at all. So it's all about their visual sensory. The next level is exploratory actions. And the main thing here is in level 4, the previous level, they're able to learn. And in this level, it just carries on. But they also just start using their core 5 senses, or all their senses. But I put a 5 here to help you remember the core 5 senses. And so during this level, you can use different things to help them go along with their activities. And the final level is planned actions. Now this is normal functioning, and I have a Mobius strip here to really represent a more complex idea, and this is higher thinking, higher level of thinking, cognitive functioning. Mobius strip is a mathematical strip in which there is it looks like there's 2 sides, but there's only really one. And so if you make one, or if you YouTube it, you'll see that there's only one side. So that is the frame of reference. And it has been updated by Linda Levy in 2005, and she really added more research, updated research about memory and working memory. This frame of reference is used today and has really helped occupational therapy as a profession. Thank you so much for listening about Allen's cognitive levels of functioning.